Today we're going to demonstrate how to put on sterile gloves. So before you open the package, you always want to inspect the package to make sure that it hasn't been opened or torn or gotten wet in any way. You also want to look at the expiration date and see that it is appropriate before you use them. So once you do that and everything is okay, then you just open the outer package, and the outer package obviously is not sterile. And inside you just grasp the package that the sterile gloves are in, and you can throw that away. I want this to be at my waist height because in sterile technique, anything that goes below your waist is considered not sterile anymore. And so then I open this up, it's like an envelope kind of, and the cuff side should be pointing toward me. And I open up little flaps on each side, and now 1 inch around the whole package would be considered unsterile. And so I'm going to keep that in mind as I'm opening this up and getting ready to put my sterile gloves on. And I want to try to get my package so that it won't flip back down onto my sterile gloves. If it should do that, that would mean that my gloves are contaminated and I would have to start over. Okay, so with my non-dominant hand, I want to pick up the first glove, and I want to touch it where the cuff is and where my hand is going to go. So I pick it up and I step back because I don't want my finger of my glove to touch anything, and I pull my glove on. And then I just leave it like that. I'm going to keep it above my waist. Now I'm going to put on my other glove. Now this time I want glove to glove because that part is sterile, and I want it to touch only the sterile part. I pick it up, put my hand into it, and pull it on. Now at this time, because both hands are sterile, I can adjust my fingers if I need to, but I don't want to touch my cuffs because that would be more chance to contaminate it. And I want to keep my hands above my waist. Now I can do whatever sterile procedure I need to do. After the sterile procedure is over, I'm ready to take my gloves off. I want to take them off, and the first glove I want to grab it glove to glove. And as I take it off, I'm trying to get it into the palm of my other hand to keep it together. And then I do skin to skin. That way I'm trying to avoid touching anything that might be on my gloves. And then I'm going to get rid of these in whatever waste receptacle the hospital or wherever you work wants you to do. And then I do hand hygiene.